When you have a new baby, there are times when all you care about is just getting them to sleep. Which is why with 10 babies dying every single day in the U.S. from sudden unexpected infant death or SIDS, getting them to sleep safely can be one of the most important things you do as a parent. I'm Dr. Darria. I'm an ER doctor, I'm a mom, and I'm a mom-to-be again very soon. And I have been on the receiving end of those phone calls when the paramedics call into the ER saying they are bringing in and performing CPR on a 4-month-old baby boy whose mom called 911 when she found him not breathing in his crib. I never want to get those calls again. And I know that you never want to have to make that 911 call. Which is why we are in the nursery today talking about my 5 tips for safe baby sleep. So I want to thank Bear for being my trusty little demonstrator today. Tip number 1 is back to sleep. Always put your child to sleep on their back, not their stomach, not their side. Just that one thing alone can cut their risk of SIDS by 50%. Tip number 2 is to co-room, but don't co-sleep. So for the first 6 months to a year of my baby-to-be life, he's going to be sleeping in my room at night in one of these bassinets. Now this is a halo bassinet that I'm going to be using. You can use this or other bassinets because this way your child is, as I like to say, within arm's reach but out of harm. And that's because having the baby sleep in your room, according to new guidelines by the American Academy of Pediatrics, cuts their risk of SIDS by 80%. But we have to make the important caveat that it's not in your bed, because sleeping in your bed can quadruple their risk of SIDS. So have them in your room in some sort of bassinet that is safe for infant sleeping, like this one, like the Halo bassinet or other bassinets, but not in your bed. You're going to really drastically cut down on your risk of SIDS. Tip number 3 is get everything out of the crib besides baby, of course. You can see in the bassinet, in the crib, nothing is in here, just baby. There's no safety bumpers, and I have to say, even those that are labeled as safety bumpers by the manufacturer are recommended against by the American Academy of Pediatrics, by the Consumer Product Safety Commission, and by me, because they are still a risk for strangulation for babies. There's no wedge, there's no blankets, there's no pillows, there's nothing but baby. What you can do to keep them warm, especially in the first few months, I love a good swaddle, or one of these which is a wearable swaddle blanket. This is for when they're a little bit older, but when they're younger you can also use those kinds that have the Velcro that comes across their arms and really makes that wearable swaddle for you. Again, that's all you're going to have in the crib is baby and some sort of swaddle or wearable blanket in those first few months. Tip number 4 is to consider a pacifier. Now, if your child isn't using a pacifier, you don't have to introduce one just for this reason. But if your child does like a pacifier, then at night, give them the passy. No leash, no nothing. If the pacifier falls out, that's okay. But studies have shown that they can reduce the risk of SIDS just by having the pacifier in there with them. The last tip that I have is to breastfeed as much as you can. Now, the guidelines say that breastfeeding for 6 months is the very best protection for SIDS. If you can't make it exclusively to 6 months, that's okay. Do whatever you can because every single bit will help protect your baby. I'm Dr. Darria, helping keeping you and baby healthy, safe, and happy. For more tips on how to keep your family safe and healthy, subscribe at drdarria.com. Follow me on Facebook at Dr. Darria Long Gillespie or on Twitter at Dr. Darria.